Interesting last night was the way that everybody was affected by the news that broke about Boris Johnson. I was actually talking to one of my children on FaceTime when I got a message that he'd been sent to intensive care, and I was quite shocked. And I mean, I'm not by any means easily shockable, but I looked at the way that people were reacting on Facebook and Twitter and stuff, and people were genuinely kind of really sad about it.
Yes, genuinely really sad. So I think, firstly, it's an enormous political leveller.
Yes.
So there was no truck for anybody that wanted to use it as any kind of an excuse for how he may have performed or behaved recently. So I think, the humanity, the compassion of this man, for this man was really, and it was a complete nation in shock, because he's been at the very forefront of telling us to, stay at home and save lives and all the rest of it. And he seemed to be okay, and he didn't look well the other day when he popped out of Downing Street. But I think the reality of how random and awful this virus can be just shocked everybody simultaneously, expecting him to be the figurehead that would get better from it and give us some reassurance, whereas the reverse happened.
Yeah, because I was saying the other day, it's a little bit like the conversations we used to have about cancer, that eventually you will know, I think 1 in 4 people gets cancer. So basically they say, well, you will know someone, quite well in your personal circle who has cancer. Similarly, I was saying, I think it will get to the point where you will know somebody quite well who gets coronavirus. And funnily enough, I think for those who haven't had that experience, Boris was that man.
I absolutely agree. And even for those who have had, there's always, a friend of my granddad's, blah, blah's got it. They're not people that they instantly recognise or represent the sort of the hope, if you like, of how we're going to get through this. And that is just an enormous shock. I'm like, it would be the Queen would be a similar kind of, perhaps more magnified than Boris, but there aren't very many people in this country to whom we would hear that news and not feel a shockwave through the entire nation.
Of course. I mean, in a way, the Queen wouldn't be such a surprise because she is older. He, I think, because he's such a sort of figurehead, as you said, and he's also this very charismatic figure and very kind of apparently energetic as well and healthy. He might be a little bit overweight, but you don't look at Boris Johnson and think, there's a guy with health problems.
No, you don't. It's a guy in his mid-50s, and he's very tenacious. So I think, for a while he was thinking he was going to be Churchill, who I think Churchill had 2 heart attacks, one just before just after the Japanese attack on Pearl Harbor, and another one a few years later. And he, big guy, cigar smoking, whiskey, quaffing, 20 years older. And I think that's what Boris wanted, and we wanted him to be that person. We wanted him to pull through in that way. And of course, for him to be defeated by it is not a weak man. He's not a man who gives in easily either. So we know he's not being mollycoddled here. This is a very serious illness for him. And that adds to our sense of shock and a reality check.
Yeah.
Really.
And without wishing to give too much credence to these really, really appalling people who have been wishing ill upon him, what's the psychology behind that? I mean, that's pretty sick, isn't it?
It's pretty sick. I mean, it's it's the karma psychology, isn't it? Well, if we hadn't left Brexit, or if we'd handled this situation earlier, this wouldn't happen. It's the people who don't vote for him politically, who are disappointed by the way he's performed, coming out and literally saying, well, it couldn't happen to a nicer person. I mean, it's really cruel. It's inhumane at this point, and a lot of people on social media are saying, just pack it away. If I see that kind of thing, you're blocked or you're reported, because it is one of the few times, out of respect, compassion and humanity, something we need in equal measure right now anyway, all the time. It is not the moment to be critical of him. It's a moment to think about his family, his friends, his partner who's pregnant, and just think if it were one of your relatives, how would you feel?
Yeah, I know. And why is it that this has happened to people, though? Because it's never been like this bad before, in my recollection of party politics. There was plenty of reasons for division, when Harold Wilson was Prime Minister, when Ted Heath was Prime Minister, even when Tony Blair was Prime Minister. But it didn't seem to be quite as nasty as it is now.
Well, I think social media generally has become a nastier place. You've also got people who are highly, highly anxious at the moment. And with that anxiety, that constant level of cortisol and adrenaline in your system, that makes you angry. You're quick to anger and lose your temper. So that's going on. Plus, you've got all those people residually who are still seething with resentment at what happened over Brexit, even though we can barely even remember what that was now. There are people who still sort of wanted him to be culpable in some way, and here's their opportunity to say, well, what goes around comes around. I mean, and it's they're typing it or saying it before they give it any human, compassionate consideration.
Right. Yeah, but I mean, you say people seething over Brexit. I mean, why? What's wrong with them? Stuff happens. You might not agree with it. You might not have voted for it. Why are you seething still?
I guess there's seething. That hasn't actually kind of formally happened yet, and there's still some people out there who are thinking this might even be an opportunity to kind of overturn the thing. But it was in our psyche for years. It was 3 years, wasn't it, where that was virtually the only topic of conversation.
Yeah, I know.
And it takes a long time to get that out. And so what happens is something like this happens and it triggers those people who may not think that they're very angry about Brexit anymore. They're much more resigned to it. But boy, something like this happens and back comes that vitriol.
Yeah, because I was rather hoping that the good side of the human race would come out of all of this. And in many ways it has. There are lots of people doing some really nice things for their neighbours.
I think it has. On balance.
And that's why, I don't want to dwell too much on the scumbags that say those horrible things. Because I think, by and large, our communities are actually kind of responding quite nicely. I
agree. So it's we've got 2% of people on Twitter anyway, and a very small percentage of that are behaving badly. So actually, overall, we're doing incredibly well. We're being very robust as a country, very good at reacting to what we need to do. We only hear about the tip of the iceberg in any of these situations, the minority that, spoil it for others or make their voices louder than others. But generally speaking, I think, pretty much when I looked at my social media timeline last night, no one was having any truck with anything other than just look at it on a level of decency and consideration.
Yes, absolutely right. Well, listen, Joe, thanks very much indeed for talking to us. I'm very, very much in admiration of the fact that you haven't gone anywhere for 3 weeks. I think that's quite remarkable. You should get some kind of prize for that, shouldn't you?
We're joined now by Jonathan Ashworth, the Labour MP, of course, reappointed yesterday as the Shadow Health Secretary, and he joins us this morning. Good morning to you, Jonathan.
Good morning.
Delighted to see you're back in the same role again. You've been offering a lot of, I think, very constructive thoughts to the government over this time of national crisis. Your immediate reaction this morning, to, of course, the very, very worrying news last night that Boris Johnson is in intensive care.
Well, it's absolutely awful, and all our thoughts are with him. Look, we are rooting for him. He is our nation's Prime Minister, and whether people voted for him or not, we all want him to see a speedy recovery because we need him back, fit and healthy, leading and coordinating the nation's fight back to this awful, awful virus. But of course, he's not just a politician, he's also a father with his fiancée. They are expecting a child, so my thoughts are really with him and his loved ones, for which this must be an unspeakable, awful time for them. And of course, he will be getting the very best care in the NHS. Our NHS staff will be absolutely fantastic in looking after him. But we really are all rooting for him, and our thoughts are with him today.
Yes, indeed. Again, as you say, I don't think it matters how one feels about politics and political parties or Brexit or anything else. This is fundamentally, we're talking about a human being. Now, we've been speaking to experts all morning who suggest that they are concerned that the Prime Minister's situation, his health, is in a more worrying state than perhaps we are being told. We were told yesterday that he had been given oxygen before moving to intensive care, and he was not at that time on a ventilator. No update confirming either way whether he's on a ventilator yet today. One of our guests we just spoke to, Roy Lilly, used to be an NHS Trust chairman. Obviously no personal information, but he said that he, like many and other people I've spoken to this morning, suggests that actually, you're not getting an intensive care bed unless you absolutely need it. And it's although there are many in intensive care who don't have ventilators, there will be a big fear that actually he has had to be sedated. He is on ventilation. Is it absolutely vital that if that is the case, if and when that is the case, that information is made public immediately?
Well, I'm sure that Downing Street will want to be completely transparent and offer the public the reassurance and the clarity that is appropriate. I mean, I can't second guess what his particular medical requirements at the moment are, other than to say that the NHS will be doing that absolute best for him and will be giving him the most exceptional, brilliant care imaginable, as they would to anybody else, because we can be so proud of our NHS and the way in which they have responded to this crisis. It's clearly a very worrying time, and I think the broader point about this is look, this virus does not discriminate. You can get this if you're elderly or if you're vulnerable with underlying conditions, but you can get this if you're seemingly fit and healthy, and it's why people really, really, really must follow the rules, stay at home, wash their hands, observe social distancing, and so on, because we have all got to pull together to beat this virus.
Let's talk to Lucian Hudson, though, who is, of course, former head of government communications in many different areas, now working with Thinking the Unthinkable. Lucian, very good afternoon to you.
Good afternoon, Mike.
Thanks very much for joining us. Now, people have started to ask the question, before everybody became slightly obsessed with the situation regarding the Prime Minister, about where we go next and when the exit strategy becomes apparent. Clearly, the government have still got plenty of things to discuss before that. But what's your thinking on timeframes here?
Well, I'd say first and foremost, the current situation hasn't changed. Whatever's happening to the Prime Minister, the best way we can support the Prime Minister, and he seems to be commanding broad-based support in his current situation, is, as well as sending him our good wishes,
yes,
is to stick to the strategy. He's led on that strategy. He's been single-minded about it. He's got structures in place in government. And I think we mustn't lose sight of the fact that we're still having to crack down on this ghastly epidemic, which is democratic. It hits anyone, including the Prime Minister. I think until we have a clearer view of what the peak is, and that's more likely now, more likely to know next week than this week, until we're clear about the peak and the impact of the social distancing that we're all meant to be following still 2 weeks on, 3 weeks on, it'll be very difficult really to talk about next steps. However, I'm absolutely sure, talking to sources, that the government is looking at what it needs to do in terms of how we go forward, because clearly a lockdown strategy as it stands is not sustainable. But the government's absolutely right to say that the focus has to be at the moment beating the virus by reducing transmission through social distancing and then increasing testing, in building NHS capacity in the short term, and obviously finding, developing, and then using vaccines and treatments in the longer term. Unless we have this very high cooperation from the public, very high compliance with the measures set out, and we get that strong and effective response from the NHS, it's very difficult really to speculate on next steps. But we can, because we want to have something to look forward to.
Yes, exactly right. Because I've been telling people this week in particular and towards the end of last week that the government strategy, which was not to reduce the number of deaths but to reduce the numbers of people having to be rushed to hospital, seems to be working, because all the anecdotal evidence that I'm hearing from people working on the front line of NHS hospitals are saying that basically they are coping at the moment.
Well, they're coping at the moment, and we shouldn't take any of that for granted. That's why all our politicians, whether it's in government or cross parties, are right to praise the efforts of the NHS, the doctors and nurses, and indeed all the essentials workers who are keeping the country going. I think the main thing, though, is to continue with the social distancing, and there can be no let-up. There was a piece of research done by a research fellow at the University of Oxford that again shows that if left to our own devices, we infect 3 people, and they in turn infect another 3, or could infect another 3. And before you know it, one person can infect 1,000 over 6 weeks. With the social distancing, even if you reduce that by a third, the rate that the transmission is greatly reduced. And I think that discipline, because it's an invisible killer, and we need to stick to it.
Yes. Is it the case, do you think, that this has become a much more virulent virus than we realised that it was at the start?
Well, I think what we're already realising is that no one group is particularly immune from it. Right. We are already picking up, are we not, that if you're male, you may be more receptive than if you're female. Yeah. If you've obviously got underlying conditions. But what we're also finding is that we cannot take a risk, whether we're healthy or not. And that's why I think it's important over time for the government to have a better sense of, just how much this virus has spread and whether or not we've reached a peak and whether or not the trend is reducing.
Yes.
And even then, I think if you just take the advice of the scientific advisory group on emergencies that published their thinking just before the lockdown, we may have to just brace ourselves for a continued lockdown, albeit a lockdown that may be tightened or relaxed, depending on the group that most needs protecting and how much we need to get the economy moving again.
Yes, because I was going to ask you, given your experience in these matters, if you were to suggest, for example, to the government as an advisor, this is how you might wish to relax the... I think we all understand what would happen if they tightened the grip and said to people, just don't go out at all. But if, for example, it was to be relaxed, where would you see the first kind of way of going there? Would you relax the kind of freedom of movement? Would you relax the opening of bars or restaurants or what?
Well, I think first and foremost, the government's priorities will be public health.
Yeah.
They cannot take any risks with public health. And I think whatever you say about the government and how much it needs to get right, a whole range of things, whether, it's beds, whether it's ventilators, whatever it is that it needs to get right in terms of the operation, it is absolutely single-minded about putting public health first. And I think public health comes first, obviously those directly affected, but those who may be indirectly affected. And there's another group still who might be affected because of underlying conditions or because they are in an economic category where they're just more vulnerable. I think the government will think first and foremost public health. It will then think economy and what it takes to keep the economy moving.
Yeah.
We may well look again at what makes for an essential worker. Government is absolutely right in its classification at the moment, but might want to look at that again. And then finally, I think there's the social, how much we can restore some semblance of normality. But we've learnt over the past 3 weeks that it's in our power as citizens whether or not to comply or cooperate with what the government advises. And as long as we follow the advice, there's a fair chance we can beat this. If we don't, not surprisingly, it delays not just our dealing with the epidemic, but it delays our ability to recover as a society. And that's what people need to think through, how much continued self-discipline they need to exercise for us to pull through. I would have thought we want to get into a position where we're looking out for those people who might be most vulnerable. But at the moment, we're all vulnerable to one another if we do not follow social distancing.
Well, that's right. And there are many people out there, not so many as there were, but still a few, who are arguing that this might be the wrong course of action, that the lockdown might have been a step too far because it will harm more people in the end than are harmed by the actual virus itself. But they point to places like Sweden, which has been a much more relaxed attitude as far as social distancing and all of that and shutting everything down. But people in Sweden, there are certainly plenty of scientists in Sweden who are saying that they think the government is acting wrongly. Similarly, we hear that Japan has got a very low death rate, apparently. However, they've just declared a state of emergency in various different cities. So nobody really knows exactly what the right way forward is.
That's precisely right, Mike. As you were saying yesterday, better safe than sorry. I mean, I would love to have the benefit of hindsight. We all would. But we can only act with the information or lack of information we have at any one point. And what we have here, a government under the Prime Minister's leadership that has set a very clear, simple strategy, informed by scientific advice, medical advice, and supported by a huge operation, including the NHS, but broad-based support of opposition parties and, of course, the trade unions and business. And I think we're seeing now an opportunity for our society to exercise more collaborative leadership. We'll always need leaders, but where I'm coming from and my colleagues at Thinking the Unthinkable is that we need to rethink leadership too. And some good will come of this in that if and when we pull through, we will have other ways in which we come to settle our differences. And I hope the science drives our decisions or informs our decisions more, because without that evidence, it really is difficult to justify next steps.
Yes, it really is. So I guess it's another wait-and-see scenario, really, because we were told that this might be the peak week, that we might know a lot more at the end of this week, so sort of following the Easter holidays, I suppose. I don't even know why I'm calling them the Easter holidays, but the Easter weekend, we'll maybe be able to draw some conclusions.
Yeah, I mean, I go back to the Queen's broadcast, which was, as well as memorable and moving, absolutely striking the right message and tone, which is, we need to unite and be resolved, and we need to keep alive some hope, some credible hope, that we will restore some semblance of normality. My colleagues and I, Thinking the Unthinkable, do not believe that we'll return to the old normal. There'll be a new normal, and we have an opportunity to shape that. Even now, though, we can't tell what that is. Why? Because we can't tell how prolonged any lockdown might be, or even if it's a qualified lockdown, what effects that will have on society, and how much the government will need to continue to intervene in terms of keeping the economy afloat and stimulating it. And these are extraordinary times, and that's why I said in a previous conversation with you, Mike, that we need to put aside, in my view, ideology and politicking. We need to really just stick to what it takes to respond to the emergency and begin to prepare for the next step, and indeed an exit strategy, but as and when we've got the evidence of how the social distancing has worked and what more might be required.
Indeed. Very well said, Lucian. Thank you very much indeed. Lucian Hudson there, former head of government communications, now working with Thinking the Unthinkable. It looks like we are beginning, I think, to draw out from this whole experience precisely where we do start to think about going next, and precisely what we need to know before we decide where to go next. And I think that's very, very important. I think the strategy has been right so far. We seem to be doing all the right things, on the right track. Those who say that we're not doing the right things, I think, don't know whether we are or not. That is the big problem.
Let's turn our attention to, the governing of this country with our next guest. Sir Lindsay Hoyle is Speaker of the House of Commons and kindly joins us now. Good morning to you, Sir Lindsay.
Good morning, Julie.
Good morning. First of all, your reaction to the incredibly worrying news last night that Boris Johnson had been taken to intensive care and remains there this morning.
It's terrible news. I'm in complete shock. There's no two ways about it. Here we have a larger-than-life figure, the Prime Minister of this country, being struck down. It's just an unfolding nightmare we are fighting. But of course, it is about our thoughts and prayers from everyone across the House. We are wishing the Prime Minister and his family the best wishes, and we're hoping for a speedy recovery sooner rather than later. But it is that shock. But it just shows you it can touch anybody, anywhere, at any time. Nobody would have expected this of the Prime Minister or Prince Charles. It really is a worry, and it is something that we've got to unite on in this country. We've got to fight this hideous virus. The one thing is, just follow the advice we're given. The one thing about Boris is he's in the right place with the dedicated staff of the NHS that are looking after him, and I know they're going to get him through this.
Absolutely, and I think we're all keeping everything crossed for that. And now we know, look, we've gone through a very, very difficult time in our country the last few years. The battles over Brexit, the battles within Parliament, particularly under your predecessor, Speaker of the House of Commons, John Bercow. There does seem to be a time now, certainly also with Jeremy Corbyn's departure as Labour leader and Sir Keir Starmer's replacement, there does seem to be a sort of a more collegiate atmosphere, perhaps a more constructive atmosphere, a greater willingness on all sides, all different political parties, to perhaps work together. It is a very difficult time, though, without a written constitution. Dominic Raab has taken over the reins of power to all intents and purposes, but we do have cabinet government, Parliament, of course, in recess, not sitting, unlikely to sit again, other than perhaps in the virtual world for some time. How much does that affect how our country is run and our democracy?
Well, the one thing we do know is that the Prime Minister made sure that Dominic Raab was well briefed, what he expected to carry out as the first Secretary of State. He's in charge. What we do know this country is good at. Government will always continue, no matter what happens, no matter how dark the hour may be. Government always continues. The people are there, there are other cabinet ministers there, the advisors are all there. So the worry is that we do want to have a Prime Minister back, but what we don't need to worry about is there are people, though, that will ensure that our country continues. In the same way, for Parliament, you're absolutely right, we are on Easter recess. We are due back on the 21st. What we will be having to, we will have to go back because we have to make certain decisions about what we will do. Who knows, it could be a virtual Parliament. We don't know. We will not make that decision until we get nearer the time of what is the best for Parliament, what is the best to do to protect MPs and the staff who work there. But there's no need to do a knee-jerk reaction to say what we're doing now. What we've got to do is plan carefully, which we did. Yesterday we had a commission meeting at the House of Commons, the first virtual commission meeting, and we were discussing the implications of what will happen as we get nearer that return to Parliament. Of course, the government could always ask for Parliament to be returned. That is in the gift of the government, but that has not come forward. At the moment, the government is governing. The one thing that you're absolutely right on, politics is different. Politics is more united. The one thing that an event like this does, it brings us closer together, working together and putting the country first. And that's what people expect, and that's what people will get.
Absolutely. And again, the government is more than one person. Even in a presidential system like in America and France, it is more than one person, all the advisors. Although we know Westminster has been particularly badly hit. We know London is the epicentre of the infection rate here in the UK, and particularly in Westminster. Now, whether that's because it just, a lot of people who perhaps done international travel and perhaps just the social circumstance they live in, but also obviously, the rabbit warren that is the House of Commons, perhaps making it particularly acceptable for people to get the virus. We know from Nadine Dorries, the health minister, onwards, people getting infected, having to self-isolate, even whether they know they've got the symptoms or not. Is it likely in any way that Parliament will be able to return in person, even with social distancing, in the next few months? Or do you think, and you've certainly mentioned, I think 5 days ago, that you thought Parliament should certainly return at least on a virtual basis?
Well, we know Parliament's got to return to actually decide what it's going to do. You just can't do it. There's certain things that will happen on the 21st, and as I say, what I don't want to do is speculate where we will be. What we do know, that we've had select committees working. They've been virtual select committees. We've had over 17 meetings of select committees doing virtual meetings, holding the government to account, getting advisors in and doing their job. So we know that part of Parliament continues, and that will continue through. What I would say is that Parliament will be prepared. No decisions have been taken. Those decisions will be taken as we get nearer. It would be wrong to speculate. As you say, we don't know where we'll be. We're 2.5 weeks away from return, and only then that we will decide what needs to happen.
Let me first start with a word of reassurance, I suppose, because Boris Johnson has done what I think is a sterling job working on the coronavirus problem since the beginning. People asking the question as to whether or not he should have self-isolated sooner. People asking the question of whether he should have been going to hospital sooner. All of these questions are nonsensical questions which I will not entertain. He is in intensive care. Dominic Raab is now deputising for the Prime Minister. He will be holding all the briefings that we will be talking to him through later. But basically, aside from the fact that Boris Johnson has gone into intensive care and has remained there overnight, nothing else in the whole situation regarding coronavirus has changed. So let's just bear that in mind. Let us just keep calm. Let us just carry on, and let us just assume and hope that Boris will emerge from this at the other end of it, like many people do, and he will be just fine. Let's talk to Nick Dubois, who is, of course, former Conservative MP, former special advisor to Dominic Raab as well, and also author of Confessions of a Recovering MP. Nick, a very good morning to you.
Good morning to you, Mike.
Thanks very much indeed for joining us. Of course, I think probably you would admit, as I will, that last night when I saw the news that he had been moved into intensive care, it seemed like an intensely worrying situation. But I wonder whether the fact that he is still in intensive care and that he is still, as far as we know it, not actually on any kind of mechanical device, that is a kind of encouraging piece of news.
Yes, and I think Number 10 made it clear he'd gone in as a precautionary measure in case a ventilator was needed.
Yeah.
Now, that the suggestion there is from doctors, and quite legitimately, that you don't go into intensive care unless you need one-to-one care and one-to-one attention. So I think that's utterly legitimate. I think the important thing to understand now, you know, Mike, I am not a medic, but I have the advantage of having a daughter who is a doctor on the front line in hospitals. And the point about this is the condition can change really rapidly.
Yes.
They obviously were concerned enough to put him in there. My understanding is, and Michael Gover's confirmed this morning, he's not on a ventilator. Long may that continue.
Yes, absolutely right. And meanwhile, the process of government does continue. I mean, there was a lot of conversations around yesterday as to whether or not Boris would have to take the decision to kind of step aside for a while in order just to complete his recovery. That's kind of been forced on him now. So Dominic Raab, a man you know pretty well, is in charge. Now, it's a tricky one, this, isn't it? Because I don't know how much credence you put on the Sunday Times story from the weekend, but it sounded as though inside of Downing Street, without Boris, it's a bit of a rat's nest.
Well, I wouldn't go so far. And to be honest, I think it was probably Tim Shipman had a hand in that. He's a very respected journalist and knows his stuff. But at the end of the day, if a leader is incapacitated at all, there is a chance of a political vacuum forming. What's good about what's happening now is the system is working. Dominic Raab is not just Foreign Secretary, he's also First Secretary of State, and he has been designated to deputise for the Prime Minister. Now, what actually happens is that in government, what you see is a lot of decisions are taken by cabinet committees and then ultimately by the cabinet. And Dominic is very much going to be, as is the Prime Minister, first amongst equals. And that's how it works in this country, supported by a civil service. So actually what we've seen is a smooth operation when the Prime Minister went into intensive care. Government will carry on. I think it's fair to say that probably most members of this government were really quite shocked when the news broke that he went into intensive care. So be it. But it is quite remarkable as the machinery of government will carry on. And I don't buy, I mean, look, it's inevitable. You're going to get lots of stories about politicians and rivalry. I just don't buy that. This is one national crisis where they are all getting on with the job, carrying out the Prime Minister's instructions, which were very clear, which is let's maintain this lockdown, let's follow the scientific advice, and until we see the numbers coming down of infections, admissions, and hopefully and ultimately deaths.
Yes, because we were hopeful that might be beginning to be the pattern as of yesterday and the day before. I guess it remains to be seen how the rest of this week goes. But certainly this is a very pivotal week, isn't it, in the so far timeline of the coronavirus outbreak.
Yes, look, I know behind every statistic there is a tragic story when someone dies, but most of us would have thought when we heard the numbers released yesterday and the day before yesterday that they were not high as previous numbers. So you kind of instinctively and perversely take a bit of encouragement from that. We have to be careful, of course, because there's a lot of talk of these weekend lag in numbers. And the key thing as well is, of course, how we're controlling infections. But this week, we have been given advice, which comes out in these press daily briefings, that we are heading towards the peak. Let us see how that goes. Hopefully we can minimise as many deaths and reduce the infections. But the true effects of lockdown, Mike, this relative pain that we're going through is actually quite significant in the sense that we have to keep it up because we won't see the results of that for at least 3 weeks. By the way, that wasn't my phone going off, just in case you thought that.
No, quite. Well, this is the thing. I mean, there are some people who are still not quite accepting that this lockdown has to go on because they're thinking that, it might not work. Well, you go, well, hang on a minute. The whole point of it is to make sure that we are not overwhelmed in the hospitals of our country and that we do not have a sudden rush for ventilators and equipment, which is short in every single part of the world, by the way. And for me, that policy would appear to be working.
Yes, and I think it's now more than ever, and perhaps one of the realities of the Prime Minister going into intensive care is that people, those who are still not buying into the lockdown argument, and there's not that many, will understand entirely why this is happening. Anyone can get this infection. Anyone can pick it up if we don't do social distancing. Now is not the time to take our foot off the brake. If anything, it's time to intensify that foot on the brake and make sure we observe them even more rigidly than we're doing now.
Yes, exactly right. And what does your daughter say about the way that the NHS is coping, without having to give too much away in terms of what she may or may not have said?
Well, I'm sort of torn as a father. She's a doctor. She wants to be back on the front line doing her bit, but she's happily pregnant, so is now no longer on that front line. She has been, obviously she's in touch with all her colleagues, and she has been quite frank when there have been some shortages of PPE in the past. I think that situation is very much improving.
Do you know what's interesting about the PPE situation, right? And I'm not saying this because I know about every single hospital in the land, but over the course of the last 2 weeks, when we've been hearing from the Doctors Association, the BMA, that doctors are frightened to go to work, that nurses are terrified that they're going to catch the coronavirus and die, every single medic that we have spoken to on the front line has said we've got plenty of protective equipment, the hospitals are not being overrun, we are doing just fine, thank you very much indeed. So I think we have to be a bit careful about that as well.
And I think the key thing you've actually said there is, let's just remember for a minute, what was the first point of the government strategy those 4 weeks ago? They said we have to contain this disease, this virus, so that we don't overwhelm our A&Es and the NHS capacity. And to be blunt, that is what we are hearing every day, that they are managing to achieve. That doesn't mean these people are working their socks off. It does not mean that in some hospitals they are under huge pressure, particularly where they've had to expand the IC units that we saw at UCL last night. But the fact of the matter is, we are fortunate enough at this situation that we have been able to increase capacity and not totally overwhelm what's been happening. And so long as we can do that, it means we can protect more lives and we can save more people. And I think that was the outline of the strategy right at the very beginning, and the government have ruthlessly stuck with that.
Yes, I think so. And it's easy, of course, to pick holes in what has gone before, because with each week that has passed in this particular pandemic crisis, everything has been moving around. I mean, I don't think I've ever seen a story which moved so quickly, or the circumstances of which moved so quickly and changed from one thing into another, literally overnight.
Well, literally, they are dealing with something that is brand new.
Yeah.
Every hour in this event, in this stage of this national crisis, every hour is a prototype. You are literally learning on the job as you are going along. That's true of the medics, that's true of the scientists, that's true of our doctors and our nurses, our frontline people, and of course it's true of politicians. But the longer this goes on, the more we learn and the more we will get to grips with it.
Yeah, absolutely right. So as far as Dominic Raab is concerned, tell us a bit about him. What we see perhaps is not what we get, I don't think, because he's not one of the greatest communicators in the world, but I suspect he comes across worse than he actually is, if you know what I mean.
Well, I must tell you, and by the way, this husky voice, please don't read anything into it.
It's not doing it for me, I'm afraid. If you're looking for any sort of sympathy, you're not going to get any from me.
Not at all. I don't know where it's come from. But one of the things, I first knew Don when he came into Parliament in 2010, and he quickly earned the respect of his colleagues, not least because of the background he had. He was, for example, he's obviously a lawyer. He was with the International War Crimes Tribunal on behalf of the Foreign Office. He was confronting people like Slobodan Milosevic. So this is no lightweight, as you can tell. But above all, I think his most amazing quality that he has is he is a very cool-headed, level-headed individual. And I've seen him right in the thick of things in the meetings with Michel Barnier, which certainly had their tense moments. I've seen him operating in Downing Street on a regular basis. And he's extremely intelligent. He's got this very cool head. And he has this wonderful, stubborn optimism. Not a lot phases him. And, he and Boris Johnson, actually, although they present as very different characters, they have this shared optimism, which I think is absolutely marvelous. He's a tough cookie, but his capacity for work, coupled with basically his forensic mind and this ability to digest and respond to a brief very effectively, I think is remarkable. My job as chief of staff was to try and be 2 steps ahead of him, right? I rarely achieved that.
No, quite. And also, I quite like there's an air of sort of menace about him as well. And we all know he's a bit of a martial arts expert, but I wonder whether he's going to hit the withering sort of look that he gives to the journalists when they're asking stupid questions. And I'm not in any way harassing journalists at this point, but some of the questions that the sort of the usual suspects, or the 3 stooges, as I like to call them, of Kunsberg, Rigby and Peston, right? I mean, if I was standing there, I think I'd be literally going, you know what, guys, today, if you don't ask a question that's actually new, we're just going to ban you from the press conference and you can send somebody else, because I like the way he looked at them. He just looked as if he was not going to put up with too much of their nonsense.
Well, I always see a glint in his eye, but I think he actually is very comfortable and enjoys taking questions. I've never seen him ever worry about that. I mean, we used to have these press conferences with Michel Barnier afterwards, and I just used to marvel how calm and cool he was. We come out of a 2-hour negotiating session, then straight into the open media, a huge collection of media, and he would take them head on. He would answer them candidly. He would always answer them candidly and authentically. I think there's a streak of authenticity in him that I think is very recherche. By the way, you talk about his martial arts. The thing that I always used to find quite curious was when I was in his office. There's in his parliamentary office. He was always followed by his poster of Muhammad Ali that adorns his wall.
Okay, that's excellent stuff. Well, listen, Nick, take care of yourself. Our best wishes to you and yours, and we'll speak to you again soon. Nick Dubois, former Conservative MP, former Special Advisor to Dominic Raab, and also author of Confessions of a Recovering MP.